What brain areas are linked to specific aphasia types after stroke? Imagine your brain as a busy city with different neighborhoods working together to keep communication flowing smoothly. When a stroke hits, it's like a roadblock in certain neighborhoods, causing specific language problems called aphasia. Different parts of the brain are responsible for different language functions, and damage to these areas leads to distinct types of aphasia. In the case of Broca's aphasia, also known as expressive or non-fluent aphasia, the trouble is mainly in the left side of the brain, in an area called Broca's area. This region is in the back part of the left frontal lobe and is crucial for speech production. But recent research shows that Broca's aphasia often involves more than just this spot. Nearby regions like the insula, especially the dorsal granular part, as well as the precentral and postcentral gyri, and the supramarginal gyrus also get affected. The white matter pathways around these areas, including the anterior arcuate fasciculus, are also important. Damage here makes it hard to speak clearly and from sentences, but with therapy, some functions can improve as other parts of the brain help compensate. Wernicke's aphasia, or fluent aphasia, happens when the posterior part of the superior temporal gyrus, known as Wernicke's area, is damaged. This part of the brain helps us understand spoken language. When it's injured, speech remains fluent but often makes no sense, and understanding others becomes difficult. People might produce made-up words or struggle to repeat phrases accurately. Global aphasia is more severe, involving widespread damage across both front and back parts of the left hemisphere. It affects all language abilities, speaking, understanding, reading, and writing, because the entire network is disrupted. It's also important to understand that language involves complex pathways called streams. The dorsal stream connects frontal and parietal regions and helps with speech production and repetition. The ventral stream links temporal regions and supports understanding language. Damage to these pathways or their white matter tracts, like the arcuate fasciculus or the external capsule, can cause a variety of aphasia symptoms and influence how well someone recovers. Other brain areas, such as the thalamus, cingulate gyrus, and parts of the right hemisphere, also play roles in language recovery and severity. These regions support the brain's ability to adapt and reorganize after injury, which is key in rehabilitation. Understanding which brain areas are involved helps speech therapists design personalized therapy plans. They focus on strengthening the remaining healthy networks and encouraging the brain to reorganize itself, called neuroplasticity. Recovery varies widely depending on the size and location of the stroke, as well as individual factors. In summary, aphasia after stroke results from damage to a network of regions mainly in the left hemisphere. These include the classic language centers like Broca's and Wernicke's areas, but also involve surrounding regions and white matter pathways that connect everything together. Recognizing this complex picture helps clinicians tailor treatments and gives hope for recovery through targeted therapy. Always remember, each person's brain is unique, so consulting healthcare professionals for personalized advice is essential.